Hello, this is Dr. David Greene, CEO of the Texas Pain Network. Today's topic is what you need to know about fibromyalgia. Fibromyalgia is a connective soft tissue disease that involves chronic, spontaneous, and widespread musculoskeletal pain, as well as recurrent fatigue and sleep disturbance. The condition presents multiple tender spots on the body that are usually found in the back, neck, chest, hips, arms, and legs. It was previously referred to as chronic pain syndrome, psychogenic rheumatism, and fibrositis. How common is it? 3.4% of women in the U.S. and 0.5% of men have fibromyalgia. The typical age range is 30 to 50. 3/4 of those with fibromyalgia actually go undiagnosed, so those numbers are truly much higher. How do you know if you have it? Well, the American College of Rheumatology has put forth some guidelines. History of several areas of aches and pains for a minimum of 3 months. Have at least 11 of 18 locations that are significantly tender. These are those 11 locations on the front and the back in the red dots. If it's close but not quite fibromyalgia, it's termed myofascial pain syndrome, but the treatment is actually the same. The Journal of American Medical Association put forth some guidelines back in the late 80s. Major and minor criteria. Major include generalized and chronic aches and pains or stiffness for over 3 months in 3 or more anatomic areas, several tender points, and also no other identifiable condition that the symptoms could represent. Minor criteria has a little list here: generalized fatigue, headaches, neck and shoulder pain, sleep disturbances, bowel irritability, or subjective numbness and swelling. Oftentimes it becomes a diagnosis of exclusion. The physician will run down the differential of what it could possibly be, and if it's checked off as not being it, fibromyalgia may end up being what it fits. Treatment options. The Mayo Clinic proceedings showed a lot of alternative medicine options that have been successful, including acupuncture, chiropractic adjustments, physical therapy and massage, aromatherapy and homeopathic medicine, spa baths, relaxing herbals, music therapy, and yoga. When it comes to medications, there are several that are used either on-label or off-label. Off-label would be various antidepressant medications, anti-inflammatories, muscle relaxers, Tylenol, opiates, Lyrica or Neurontin, which are membrane stabilizing drugs, sleeping aids, and then Myers cocktail IV infusion treatments. Lyrica is no longer an off-label for this. It actually became the first FDA-approved drug for fibromyalgia back in 2007. 2008, Cymbalta was approved. 2009, Savella was approved. We actually don't know how any of these work. We just know that they work well for the condition. Myers cocktail, there was a pilot study back in 2009 which did show most subjects experienced relief, but it wasn't statistically significant. That just means it wasn't a large enough study, okay? So it's still commonly used. There is no cure for fibromyalgia. It can be very challenging. The new studies show patients can decrease symptoms dramatically through multimodality treatment, such as the various ones presented here. And that's been put forth by the National Fibromyalgia Association. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics participating throughout the state, accepting over 50 insurances and providing over 25 treatment options with the board-certified physicians. For treatment in the Austin area, visit us online at painmanagementaustintx.com and then call us for more information and scheduling at 512-456-8886. I'm Dr. David Greene with the Texas Pain Network. Your pain stops here.